That's right. It has been 100 years, hasn't it? That's amazing.
It's remarkable to think that this organization has been in existence for already 100 years.
UHA has enjoyed a marvelous history, now dating over 100 years. Highly respected throughout the state, highly efficient in their convening, gathering, and facilitating of healthcare leaders.
The Utah Hospital Association is an advocacy group on behalf of health systems in Utah, whose mission it is to be a voice for us to ensure that we're providing quality and effective care to the people of Utah.
The Utah Hospital Association is a forum for the hospitals and health systems in Utah to get together and work together.
And we bring them together to collaborate and to coordinate and promote good healthcare policy in Utah for the citizens of Utah.
A very important part of it is to put before the governor and the legislature the needs and the advantages and the contributions hospitals make throughout our community and throughout our state.
They're a phenomenal lobbying group, but they're also a great collaborative group.
All those hospitals that are members of the association come together for the good of their hospitals, which in turn is for the good of the communities.
So they probably do 1,000 things, but boiled down, they're an advocate for healthcare and good healthcare policy for all Utah citizens.
Well, contrary to some belief, I was not here when the association was started, but I joined as the chief executive in 1978. And I succeeded a man who started as a part-time employee, volunteer employee first, before I was hired as the chief executive.
They have started small, like many groups, 100 years ago, with just 6 hospital administrators, got together and decided they needed to coordinate and collaborate better. And from that, we've grown to a major industry in Utah with tens of thousands of employees and over 60 hospitals. Initially, for many years, it was just a one-man show, if you will, maybe even a part-time person for many, many years. But starting about 40, 50 years ago, started to get staff, and in the last 40 plus years, we have been very engaged and very known and knowledgeable in the healthcare policy space in Utah.
I've heard the story about a few people that decided it was time for the hospitals to cooperate a little bit more and to get together. I don't know a lot about the initial history, but for the last 40 years, I've been involved in one way or another in the Hospital Association. When I first came into hospital administration back in 1980, the Utah Hospital Association had a huge annual meeting. We would fill up the ballroom at the Hotel Utah. There were vendors and volunteers and people from every aspect of the healthcare industry. And over time, as the systems have gotten bigger and do a lot of their own education and work within their system, then that has gotten down to a much smaller event. But it's still very, very beneficial. And for those of us that don't have systems that we can turn to for education or for board training, different things like that, the Hospital Association is phenomenal. So I can't give you the history much before the 60 years before I became involved, but for the last 40 years, I've been pretty closely involved with the Hospital Association in one way or another.
Healthcare developed across the nation in a couple of ways. Prominently, a lot of counties had hospitals. For some reason, that seemed like a county responsibility. That's what happened in Salt Lake County. So the other form of hospital were charitable institutions, and those are the earliest ones we've had. Typically, religious organizations would sponsor hospitals. So you have Samaritan hospitals around the country. You have a lot of Catholic affiliated hospitals. We had the Miners Hospital in Park City, which is an interesting part of our our history, and Carbon County and other places. Those were the package of hospitals gifted to create Intermountain Healthcare in about 1975. So that's the way our hospitals have grown up much of the time.
The UHA is wonderful because of the people that are involved in it right now. I haven't known the UHA for its 100 years of existence, but the people that are in it right now are just awesome people. My first experience with Greg Bell was before he was with the Utah Hospital Association leadership. He was still lieutenant governor, and I asked him to come and speak on healthcare related issues to our board retreat, and he was very gracious, came and spoke to us, formulated a relationship with me that I was just floored by. I was surprised with how open he was. And it's that way down the board with all of the staff. Every single person that I've met at Utah Hospital Association mirrors that kind of openness, that kind of collegiality and generosity with their time.
You know, the UHA is wonderful because it's a forum for us to work together and cooperate and coordinate. It's also a forum to share ideas. There are lots and lots of really capable leaders in this state, and the amount of shared wisdom and shared learning that we have has really been inspirational to me.
I think it's because they're very values driven. They know exactly what they exist for and why. They check politics at the door and just make sure they're focused on improving the delivery of healthcare in our communities. And that's not only the quality, but also the cost.
The UHA is wonderful for one simple reason, and that's the members who participate within the UHA. A lot of wonderful professional people care about doing good things for their communities, taking care of the needs of patients. So it's the people that make the UHA what it is today.
I don't think I could say enough about how the Utah Hospital Association affected the outcome of the COVID-19 pandemic in the state of Utah.
Greg Bell, Dave Gessel led the efforts to work with the governor, the Department of Health, the legislature, the business community, and the health systems in the areas of keeping our economy functioning while we battled this deadly virus. And the UHA was just very valuable and essential in working together and coming up with solutions. And so when we look at the pandemic as an example, we suffered less economic losses and we had better healthcare outcomes than most of the other states in the union. And that speaks a lot to the leadership of the UHA and how it was able to interface with all these other agencies, Department of Health, the governor, and the legislature.
They were also very instrumental in getting some funding from the state legislature, from other federal sources that they passed on to the hospitals, which we desperately needed to purchase personal protective equipment and other things that we could use to combat the pandemic and to respond appropriately.
Well, I'm sure the UHA didn't anticipate celebrating its 100-year anniversary during a pandemic, but like the rest of us, pivoted from our ordinary course of business and immediately began to mobilize and create a variety of different forums to help increase communication among the health systems, to advocate on behalf of what it was that we needed in order for us to protect our patients and protect our employees and protect our health system.
UHA was able to bring together in a very collaborative way chief medical officers, chief nursing officers, and then other leaders like legislators and even representatives of the governor and others, and the health department of Utah as well, to bring together and collaborate and identify how to approach next steps when ICUs are filling up, when testing is overrun with people, and UHA brought the parties all together in a way that has never been done before in our history, in Utah at least. and probably in a way that will continue for the next 100 years.
Oh my goodness, what could I say to all the caregivers, the frontline caregivers through this COVID-19 pandemic? My heart is just full for all of the sacrifices that have been made by multiple people. Those frontline people, they've really given it their all. They've worked hard. They've been fearless. I was about to say they've been tireless, but no, they've been very tired.
You know, as I think about the tremendous sacrifices that our frontline caregivers have made over the last year, and obviously the most important thing I can say is thank you. But also it would be a collective recognition that what they have done is well above and beyond the normal duties that they would have, the sacrifices that they've made, the sacrifices their families have made, for the hard work that they've done, the long hours they've provided, and the risks they've undertaken have been really remarkable.
God bless you. This is a historic pandemic that you have basically put your lives on the line to save and serve others. And how can we help you? How can we support you? Because this pandemic is not over. We've still got a ways to go. And so we need you, we cherish you, and we really rely on you.
Thank you from the bottom of our heart. I mean, what else? With the hours that they put in, the risk that they took in caring for these COVID positive patients to their own lives and to their family's life, just a huge, from my heart, thank you.
Well, I think UHA's legacy is the strength of our health system in Utah. And, we are one of the healthiest states, and I think that's not just the environment in which we live and work, but it's because of the strength of our health systems, how effective we collaborate, coordinate, how well we work together to make certain that the UHA can advocate for us and help us receive the resources that are most necessary for us to continue to be effective.
Is an organization that's honest, it's genuine, it's collaborative, and I think the one word I'd say even above those is it's steady. It doesn't succumb to highs and lows, but it's steady throughout the years.
I think the legacy of the UHA is supporting the health systems in Utah in providing high quality and affordable health care and achieving the status we have as the best place to receive health care in the entire country.
The Utah Hospital Association's legacy is that we are quiet, but we are impactful. We are not strident, and we're not self-interested. We have as our number one goal the public health of the state of Utah. And we want all citizens to enjoy equitably the benefits of good health care so they can live happy, healthy lives. I'm wearing my 100th anniversary UHA shirt today to mark the excellent, wonderful 100 years the Utah Hospital Association has served the citizens of the state of Utah.
Thank you to the Utah Hospital Association and all of its leaders and what they do.
It has been an incredible 100 years. Thank you, Utah Hospital Association, for all you do.
Thank you, Utah Hospital Association.
Congratulations on your 100-year anniversary.